Federal health officials are preparing two possible bird flu vaccines that can be distributed quickly if the virus does spread to humans. The bird flu has been spreading right now, despite the name, among dairy cattle, infecting at least 36 herds in 9 states. Are humans next? Joining us to talk about this and our health headlines, it's Dr. Bill Hartman, the clinical trialist at UW Health. Doctor, great to see you. So one human has come down with this latest outbreak of bird flu. And as far as we know, the person had mild symptoms. So why did they rush to make a vaccine here?
Well, I think that there's a couple of answers, but the most obvious is that as the bird flu has evolved and gone into other animals like the fox and bears, it's always hit a dead end. It hasn't moved on to other animals, and it hasn't been spread very easily. But now it's probably been around for about 4 months in the dairy cattle. So it started to spread from one cow to another and then to a human. And so the longer this thing kind of festers around, the more mutations it can pick up and the greater chance it will have of infecting humans and staying in humans. And so this is more of a preparation phase, getting these vaccines ready, getting some treatments ready. But it's something that we really have to keep our eye on because something is happening with this virus that's making it more virulent as time goes on.
And showing up in more animals. And I know just that one dairy farmer got the bird flu, but the fact that he got it from presumably the cows, that's kind of a big deal for those who work in public health.
That's correct. And I think that we do have to focus an effort on our dairy farmers to make sure that they're protected. As they clean up the stalls that the cows are kept in, they can aerosolize this virus, and it can be inhaled, and they can pick it up pretty easily. The virus, if it doesn't mutate beyond what it is right now, there are receptors within the human body that can accept this virus. And so especially for dairy farmers that come into contact with the unpasteurized milk and these infected dairy cows, we really have to make sure that we have them protected so that they don't get sick from the bird flu.
And we do have a few of those in the state, dairy farmers. So humans, we haven't been hit hard by this yet, but the same cannot be said for those dairy cows. The good news coming from the FDA, though, cottage cheese and sour cream are safe to eat. What did the new testing show?
So last week we heard that the virus had shown up in the commercial milk supply, but they didn't know if it was active or not. Now it seems that the virus is completely inactive, and that the same holds true for other milk products like sour cream, like cottage cheese. So the commercial milk supply and associated products appear to be very safe to consume. You can't say the same about unpasteurized milk. Stay away from unpasteurized milk right now. It can contain large amounts of the H5N1 virus.
Good tips there. Hey, this is completely on a different topic, and we only have like 20 seconds here. But for those of us who are smog breathing, fumes sucking in as we sit in traffic, people, good news. Research shows we will live longer than people who live in rural areas.
There is this rural-urban divide when it comes to healthcare disparity. And people who live in rural America are more likely to die from the 5 most common causes of death, including heart disease, stroke, et cetera, than people who live in urban environments, probably because they take a little bit longer to get to healthcare. They don't have as great of access to healthcare. We have to figure out ways to make it easier for people in rural America to get the healthcare that they need.
Yeah, that was eye-opening for sure. Dr. Bill Hartman, lots of interesting stuff there. Appreciate your time.
Thank you.